We interviewed 30 queer, trans, and non-binary youth aged 17 to 29 from across British Columbia to hear about your experiences navigating the COVID-19 pandemic and its associated public health measures. We asked about how you navigated lockdown periods, shifting guidelines, emerging science, and the new normal. We asked about your mental health, relationships, substance use, accessing health and social services, education, work, and financial support. We heard about the new opportunities that emerged during these exceptional times, as well as the struggles you faced. You told us about the innovative solutions you came up with as you learned to cope with these new challenges, like using technology in adaptive and creative ways to meet your physical, social, and emotional needs. We heard that substance use was less likely to be about having fun, and that you were less likely to consume drugs associated with partying and celebration. Many of you continued to use substances socially, although the social context had often shifted online to group chats and video calls. While most of you had implemented creative technological solutions to isolation out of necessity, there was excitement around returning to a normal where you could once again share physical spaces with people. Some of you told us about how the skills you had learned earlier in your lives through access to high-quality mental health care helped you through the different phases of the pandemic. You told us about how much you appreciated the relative ease of access to mental health resources that were rolled out during early phases of the pandemic. We learned more about how investing in high-quality mental health resources in early life can provide queer, trans, and non-binary youth with lifelong skills that can be applied individually in resourceful ways, even as contexts shift dramatically. The idea of limited resources in the context of a publicly funded healthcare system under increased stress came out in your stories. We wanted to point this out to participants and let you know that you always deserve access to healthcare, including mental health care. We will also bring this finding forward to service providers and policymakers so that they know when a youth approaches a clinician for help, that youth has already carefully weighed their needs. We heard that you want to see policy-level changes that acknowledge both the difficulties you have been through, as well as your capacity to contribute in inspired ways to solutions that take into account the realities of being a young queer, trans, and non-binary person in the current context. We would like to thank our funder, the Canadian Institutes of Health Research, for their support of this project.